My name is Duke Heller, and I met Dr. Hilt Tatum in 1973. And I would say that Hilt Tatum changed my life, and he also gave me the information I could use to help so many other dentists.
Dr. Duke, how did you first meet Dr. Tatum, and what were your first impressions of him?
Well, gee, that's an interesting thing. I was in graduate school doing research, and 1973, Dr. Tatum called me. I didn't know who he was, and he said, "Tell me about this tricalcium phosphate." He said, "I saw the paper that you wrote on that, and how, do you have histology?" I said, "Yes. Would you send me some?" So I did. He called up and said, "How do I get my hands on this material?" I said, "Dr. Tatum, you need to understand it's not FDA approved. I'm using it now in animals." He said, "Well, I'm doing a dog study. Can you send me some?" So as I recall, I sent him 2 5-gram bottles, which was fairly large. And so about 8 months later, I got some histology from him. He said, "This is a punch biopsy." I said, "In the animal?" Well, yes. Well, I knew that he had put it in, as you would guess, a patient, and it showed so much potential. So I guess Dr. Tatum and I never met personally until a couple years later. He asked me to come and present my findings at the Alabama Implant Congress, which I did.
What was it about your friendship that made it so strong and unique?
I think the big thing is Hilt and I both realized it was important to be truthful. So if we did a procedure and it didn't work, then be honest and try to find the solution. Dr. Tatum was the one responsible for creating most of our techniques in implant dentistry. I developed several of my own. Some of those were in an attempt to improve what Dr. Tatum had started, but we always discussed what I was going to do. So we developed a relationship of honesty and integrity. Tell each other honestly where it did not work.
Can you share a favorite memory or story that captures who Dr. Tatum was as a person?
I sure can. Dr. Tatum, he came and lectured many times at the Midwest Implant Institute, and he'd have 4 projectors. And he called me the 2 days before he's supposed to be here, and he said, "Duke, I just fell off a horse, and I fractured L2 and L3. I said, "Well, okay, Hilt, I'll just have to try to do all these surgeries myself." He said, No, I'm coming." I said, "You can't come with that." He said, "Oh, yeah, I can." So I pick him up at the airport, and he's taking little 3-inch steps. And so he said, "What time are we supposed to be there tomorrow?" And I said, "Well, the first patient will actually start at 8, but we've got to be there at 7 to discuss the case. The class is full." And so he said, "Okay, wake me up at 4:30. I said, wake you up at 4:30? He said, yes. He said, I'm going to get in the tub and put very hot water and try to exercise. So sure enough, I call him at 4:30. He gets out of the bed, crawls to the bathtub, puts very hot water in. From about 4:30 till 6:30, he was, or maybe 6:15, he was in the tub. He came out, came downstairs, and he was taking little bigger steps. We came, and I can't believe it, that man helped me do surgery for 3 days, and with that back problem.
What was something about Dr. Tatum that most people didn't know but should?
I believe it's the fact that time meant nothing to him once he started surgery. If the patient was scheduled for an hour and it took 2 hours, that never bothered him at all. He would apologize to the next patient, but I think people would visit the office and observe that, but that's really the way he ran his life. I've been with him staying up till 3 and 4 o'clock in the morning, just sorting slides because he wanted to put in his presentation a brand new case. So he'd rearrange everything. So time to Hilt Tatum only meant that you did it to perfection, and if you had to sacrifice sleep, do it.
How would you describe Dr. Tatum's character and personality beyond the professional world?
I think one characteristic of Dr. Tatum was that if you took an interest in what he was teaching, even if he didn't know you, he would spend time with you answering your questions. So I think Hilt really felt called to teach dentists the true art of implant dentistry.
How did your friendship evolve over the years?
Well, obviously it started with the research with tricalcium phosphate, and then we became fast friends because we both wanted to educate. Hilt taught in the dental profession at different courses and different meetings. My main direction was that at the dental schools. I had the privilege of helping start 8 different programs in dental schools on dental implantology because somebody had to teach the faculty. At that time, then the faculty would assist me doing surgery, and then the faculty would do surgery. So we did that for 9 months. Then we always went back about a year after that, and I would take Dr. Tatum, ask him to come with me as we would go back to that dental school, and then we would teach advanced courses on bone grafting, Ramus frame, subperiosteal, and mainly there were procedures such as sinus grafting that he would teach.
Were there any moments where you leaned on each other during difficult times?
I believe there was, in that we both got referrals of failures that other dentists had done, and they would refer those to us. So many times we would call each other up. We didn't have the technology back then, but we would describe the failure that was there. Sometimes I could forward x-rays, and he would forward them to me. So I think we worked together as a team to try to help dentists that had failures, and then we wanted to find out how we keep other dentists from having those same failures. So I would say we leaned on ourselves there, and it was just a mutual relationship of trying to solve problems.
Dr. Tatum was a pioneer in so many aspects contribution to the field?
I believe that dental history will show Dr. Tatum's contribution of the lateral sinus, the membrane being elevated and increasing bone height in the sinus area. I personally think Dr. Tatum will be known for that procedure. And I know I assisted him several times when he did sinus lifts, and that's how I learned.
What was it like collaborating with Dr. Tatum on advanced implant techniques?
One of the things I so enjoyed is we almost always reverted back to anatomy. So what the anatomy the patient provided us, we had to either change that anatomy or adapt to it so that the patient could end up having full function of masticating food.
How did he challenge and inspire you as a clinician and an educator?
That's a good question, how we inspired each other. I would say one thing that we would do, we would take successful surgical procedures and then brainstorm how could we improve them, either with membranes or tissue relaxation. But I think we spent a lot of time, and many times, 2 or 3, 4 o'clock in the morning, discussing already successful procedures, how we could make them more successful.
How do you think Dr. Tatum would want to be remembered in the dental world?
I think he'd want to be remembered as a man who obviously had a lot of God-given talent in surgery, but God gave him the ability to analyze situations and to overcome those areas of anatomy that needed to be improved upon. And I think Hilt would want to be known, realizing that God had given him some talents that many of us don't have, but he wanted to share with us how we could also get similar success as he was getting.
What did Dr. Tatum believe was the most important lesson for young dentists to learn?
I believe it would be to find a mentor and then learn from that mentor. Learn to do surgery by assisting your mentor and then having your mentor assist you, and then you do the procedure with your staff assisting you. Hilt and I both felt very strongly that if you're going to learn implant dentistry at its basic, you must observe, you must do, and then your staff must assist you. I think also Hilt and I, at one time, might have been the only 2 general dentists that did, as best we could, total sterilization. We both believed that the bacteria in the mouth needed to be reduced and attempt to eliminate. And so both of us were proponents of full draping in surgery for every procedure we did.
Can you share a moment when you saw his brilliance at work firsthand?
I sure can. I remember being present when he took 2 millimeters of bone in the maxillary arch, and he started with a scalpel to separate this bone, and then he used increasingly larger sized instruments to manipulate the bone to make it be able to accept a 3.8 millimeter implant and still had 1 millimeter buccal bone and 1 millimeter lingual bone, and he was able to place that. I was astonished that he was able to do that, and of course, from that, he taught me how to do it, and then I've really taught thousands of dentists that technique because I learned it from Hilt.
What does it mean to you personally to have both of your names on the Alfred L. Dukeller and O. Hilt Tatum Comprehensive Oral Implantology Residency Program at Jacksonville University?
Well, we both felt blessed that our names would be used. We couldn't believe that they were going to do that. We both talked about that. But I think it was such an honor to be even mentioned with Hilt and that same residency program. So I'm deeply appreciative of Hilt and what he did, and he just brought me along on his coattail. But we have dreamed about implant dentistry being a specialty at least 35 years. We used to talk about it, and now it looks like that it's going to come about. Our residency program is into the third year, and maybe I'll live long enough to see implant dentistry recognized as its own specialty.
If you could have one more conversation with Dr. Tatum, what would you say to him?
Well, I would thank Hilt again, which I did many times, for sharing with me his knowledge, and I would thank him for allowing me to teach with him as we traveled the world together teaching, and also in the United States. So I would just thank him again, and I can promise you that many times over the last 3 to 4 years, I personally thanked Hilt for the information he shared with me that I was able to share with others.
What would you like the world to remember most about Dr. Tatum?
I believe that he loved to teach, and I would say without a shadow of a doubt that implant dentistry, Hilt felt, was an assignment that God had given him to share with mankind. And he and I had that discussion many times over the last 8 to 10 years.
Is there a particular moment or image that you hold in your heart when you think of him?
Yes, Hilt and I used to FaceTime, I would say the minimum of 3 to 4 times a week, and we always felt so thankful that God had used us to perhaps elevate a science that would be so beneficial to so many. And Hilt certainly contributed more than I did, but it was my privilege and certainly my honor to work close with Hilt. I talked to him so many times each week, and I hardly ever got off the phone. I didn't thank him, and I also told him I loved him.
If you had to describe Dr. Tatum in just 3 words, what would they be?
Determined, dedicated, and devoted. I loved Hilt Tatum, and he certainly, I believe, loved me. We had so many moments together toward the end of his life, and I know those 3 characteristics were Hilt Tatum.